Hi, I'm Mark.
And I'm Victoria.
Today we're going to talk about a condition that's relatively common that affects kids, which causes pain in the back of the heel. It's got a couple of names. Calcaneal epiphysitis is one. The most common one, and it's my pet hate, is Sever's disease because it's not actually a disease. So what are the symptoms of this condition?
So the main symptom is pain in the back of the heel, usually after sport or cooling down after sport. They'll often have a burning pain or a throbbing pain where they won't want to put their heel to the ground.
Yeah, and are there any signs, anything visible?
There can be redness and swelling, but not always. The most common sign that you'll see is them walking on their tippy toes, and that can happen earlier and earlier when they're playing sport if it gets worse and worse.
Yeah, okay. So who's prone to this?
Typically it affects active kids playing a wide range of sports, and it'll usually kick in between the ages of 9 and 14 when they're going through a growth spurt.
Yeah, so they have a growth plate that runs across the back of the heel, and having tight calves and doing explosive actions really pulls on that and gets it inflamed, doesn't it? So what's the treatment for this?
Well, the main treatment that we'll do, firstly we've got to diagnose the condition correctly.
Mm-hmm.
We'll have a look at their footwear and discuss any activities that they're doing that might need to be modified. And then the main thing that we do is stretching to help it ease off and stop pulling.
So it's not easy to get kids to stretch. They often don't get it and will tighten up protectively. How do we achieve this?
So what we do is we work with the parents and teach them what's called a proprioceptive neuromuscular facilitation technique, or PNF stretching for short. And we'll coach the parents on how to do that with their kids daily, just to prevent that traction and pain from coming back.
Yeah, so things like icing can help immediately afterwards. It won't get rid of it, and we certainly do a full examination and diagnosis, but really it comes down to the stretching is the most effective form. So if you think your child is suffering from this, come in and see us. It is a relatively simple thing to treat. So thanks for watching.
Bye.